My name's Mike Joyner, and I'm a physician scientist at the Mayo Clinic in Rochester, Minnesota. In my clinical life, I do anesthesia work in the operating rooms, and that's about 20% of the time. And I spend about 80% of the time directing a lab where we study human physiology. And we specifically study how humans adapt to physical and mental stressors. Remember, I graduated from high school in 1976 and was really the beneficiary of Sputnik. So when the Russians launched Sputnik and the space race started, there was a tremendous increase in spending on science and engineering and technology education in the grade schools and junior highs. There was no specific, I'm into science because I was mostly into sports, but there was just tremendous educational opportunities. The quality of the teachers was just outstanding. So I think really the environment was probably about as good as it's ever been for a young person to get an education just without even trying that was STEM centric. So I started as an undergraduate at the University of Arizona when I was recruited to be a subject in a study on lactic acid and distance running performance. I was an athlete at Arizona and was a member of the track team. And that really got me started in research. And you can see a direct line from my participation as a human subject at age 19 in 1978 to what I'm currently doing. Because one of the things we remain interested in my lab is human performance and what makes world record performances. So my hobbies, or at least one of my hobbies, continues to be endurance exercise. And in fact, I just got done working out this morning. And I really started when I was 19. I worked in a lab at Arizona, began to work there as an undergraduate, and learned a lot about physiology, and learned also that colleagues in Scandinavia were doing remarkable things. And many of these colleagues were physician scientists. So I thought maybe I should go to medical school, and decided very early on after I started to be a subject in the lab that I wanted to be a physiologist. And then very shortly after that, I wanted to be a clinician scientist, a clinician physiologist, and be a physician. And really, I pursued that pretty aggressively. Was fortunate enough as an undergraduate kind of summer student to work in a very well-known lab in St. Louis. The labs in Tucson were outstanding. So I really got lucky by just stumbling into a very active, productive lab run by a world-class scientist. And then what happened is I ended up going to medical school at the University of Arizona. And I took an extra year in medical school to do research and further kind of burnish my research credentials, and ended up at the Mayo Clinic in 1987 to do an anesthesia residency. I thought I would spend 4 or 5 years at Mayo and go back to Tucson, but the resources at Mayo are tremendous. The environment was tremendous. I had outstanding colleagues in the Department of Anesthesiology, and I've really stayed there ever since. So I think I've finished my 33rd year and in the middle of my 34th year as we make this video. So normally in my lab, in the pre-COVID era, we have human volunteers or patients come to the Mayo Clinic, St. Mary's Hospital, where they enter something called the Clinical Research Unit, where we have a big lab where we can do exercise studies and all sorts of other things. And we enroll those subjects and they perform the studies. Now, obviously, with the pandemic, that sort of research has largely stopped. And what did we shift to? Well, we shifted to studying something called convalescent plasma. Convalescent plasma is plasma that's obtained from patients who've recovered from COVID-19. It's rich in antibodies which fight the disease, and we attempt to then take those or harvest those antibodies from recovered patients and then give them to patients with active infection. I typically get up about 4 or 5 in the morning, get on the internet, read the New York Times, have a cup of coffee, answer my email, because when you work in science now, you get emails really 24/365. You get them from Europe, Australia, and so forth. And then by about 6 or 7 o'clock, I go and exercise. Then I hit the lab about 8 or 9 o'clock. And typically we do experiments where we put catheters in people and we have them exercise, or we make them hypoxic, or we do simulated blood loss, that sort of thing. And I meet with my fellows. We plan experiments, analyze data, write papers, and so forth. We also write grants. So that's sort of what a kind of a generic day is. Now, the big unexpected thing that's happened to me is it getting roped in or stumbling onto this convalescent plasma project. This happened because a friend of mine named Arturo Casavidal, a very well-known infectious disease investigator at Johns Hopkins, he wrote an article. And I read Arturo's article. started to interact with them, we came up with a plan to use convalescent plasma to prevent and treat COVID-19. Started interacting with the U.S. Food and Drug Administration, and then the Food and Drug Administration asked me if my colleagues and I would like to run a very large, what's called expanded access program to make convalescent plasma available to patients in the United States. And that sort of took off at the end of March and in early April of 2020. And the government thought we might be able to administer plasma to about 5,000 people. But as the pandemic really grew like wildfire, we ended up treating about 105,000 people, and in a program that lasted from April to the end of August. Led to the approval of convalescent plasma as a therapeutic intervention in COVID. With the convalescent plasma project, or with the whole question, is to understand if convalescent plasma in specific and antibody therapy more generally can improve clinical outcomes in patients with COVID-19. That's really the first main question. And then the second question is, what's the optimal use case? Early in the disease, later in the disease, or in very, very sick patients in the ICU. And the emerging data from our program and other programs and other sorts of experiments throughout the world, clinical trials and so forth, is that convalescent plasma appears to be beneficial. It can certainly modify the course of disease, reduces the viral load in patients who have COVID-19, and if given early, prior to admission to the ICU or the onset of the need for mechanical ventilation, so really, really sick patients, it can improve survival as well. So people ask me all the time for career advice, and my advice, and it harks back to one of my earlier statements or answers, is I was lucky to live in a world where there wasn't as much immediate feedback as there is now. And I think one of the things is people are constantly going to give you advice: do this, do that. You have a bright future here, a bright future there. This is a hot field. Go into this, go into that. And that's all true, and we all have to think practically. But I would also tell you to do what you're interested in, and do what you find really stimulates your curiosity, and really kind of, light your hair on fire. And you can see my hair has been on fire for a long time. And I think if you do that, and if you kind of follow what you're passionate about and pursue it, you'll have a much more successful, but more importantly, rewarding experience in both the short, the medium, and the long run. So I think one of the most important things I learned to do was from a man named Emery Dobosh, who was my physics teacher in high school. And Mr. Dobosh taught us how to do dimensional analysis, or we called factor labeling at the time. And dimensional analysis is a super important thing. And where I found it to be very, very important is to sort of make what's called Fermi estimates, or sort of back of the envelope calculations. And really being able to do that has been invaluable during the pandemic as we start to scope our work and thinking about the magnitude of the problems. But it's also been very, very helpful to me as a physiologist, because if you have some general idea about the ballpark, is it going to be 50 liters, 100 liters, 150 liters? Is it going to be, large, small, medium? It really helps you start focusing your questions and understanding how you might measure outcomes you're interested in.